Yes, I'm Josie Osborne. I'm the MLA for Mid-Island Pacific Rim, and I'm also BC's Minister of Health.
You've worked in fisheries, biology, environmental stewardship, municipal leadership, and now health. What core values have remained consistent throughout these roles, and how do they guide your work as Minister of Health?
My relationships with people are something that I have always worked really hard to uphold and be true to, honest, empathetic, curious about. And I know that I cannot do anything on my own, that I'm always working in a team and being able to understand people's strengths and how to work together, how to communicate strongly. And again, to do that with honesty and integrity are really important to me. Something that's driven my work always from being a biologist and into politics is curiosity. So I'm very curious about the world around me, try to be a keen observer and really listen to people, try to put myself in their shoes and understand how their life history and experiences have led them to be the person that they are with the viewpoints that they have, and really try to listen to that person and learn from it, and at the same time work with people to sometimes just to open up minds a little bit and say, well, there are different ways of looking at things, and how can we work together to make decisions? I think it's really important that you bring together different perspectives around a table, because as decision makers, whether you're at a federal or provincial or a municipal level, or even at home in your own family, bringing everybody together around the table to talk about those perspectives and try to make the best decision for everybody is integral to good public policy, good politics.
Of course. Thank you very much. I love that answer. It really resonated with me.
Thank you so much for joining us again. So, with the British Columbia Youth Council, we get to work with people of all kinds of backgrounds and interests and experiences. What is something you found in common with everyone you've worked with? And what do you believe is something that youth should look into these kinds of relationships with people as they get their careers and opportunities?
What is something that I have found in common with everybody that I've worked with?
Yeah.
Yeah, I love this question. Um, well, one thing that is the same about all people is that they're all different, and it sounds a bit ironic, but in that each person comes to the place that they are with their own stories, and everybody has a story to tell. And I think there's a lot to be learned from listening to that story. So, asking people questions that are reflective, and being able to get more out of them about why they think the way they do, why the things that matter to them matter. Something that I've enjoyed in every aspect of the work that I've done. I think youth have really powerful voices, and I've met so many youth who are, I mean, I'm just so impressed by, I compare myself, to when I was like 14 or 18 or whatever, and I was really shy. I didn't speak up a lot, but I also didn't get asked a lot. So that is really important, to seek out people who think differently than you and then ask them questions and have that relationship. So I I think it's fantastic to have a youth council where these voices are coming together and you're able to come and ask people like me. But I mean, honestly, I would have as many questions for you as you would for me.
No, totally. Like we get to have lots of amazing opportunities, and we're really, really honored to also have this opportunity to speak to you. So, on that note, then, when we come here and we can have all these opportunities to get to
Mhm.
meet you, what is your strategy to meet someone else and to meet someone new? So, like, what is your
Oh,
way to find someone
well,
interesting?
often when I'm having a conversation with somebody, if it's a stakeholder, or maybe it's a mayor of a community, or it's somebody in the healthcare sector, and we'll talk about something, and then I'll ask, who else do you think I should talk to?
Oh,
And you get a referral kind of that way to say, I know this person who uh, who you should talk to because they've got different insights than I do. That's a great way to expand your network and to open your eyes to something new, maybe a little bit different. The other thing I would say is that I often try to like sort of drill down and meet people who are like truly on the front lines of things. So I work with a fantastic team of people inside the ministry, but I want to visit a hospital. I want to talk to a nurse. I want to talk to a recent graduate. I want to hear from the person who's working in the kitchen preparing meals for people who are staying overnight in the hospital. All of the different people who make the system work, and I want to hear from those folks.
all right. I would pass it to my colleague right now, but I have one final follow-up question. Who else should we ask next?
Oh, okay. I think you should talk to some of the staff who work in ministers' offices. Yeah.
All
And
right.
and there, there's a lot of staff in this building who are not the faces in front of the TV cameras, but they are supporting ministers, they're supporting cabinet, they're supporting us with all kinds of different aspects of their work, and they have a different role and a different set of insights.
As the former mayor of Tofino and the chair of multiple regional health councils, you've seen how health services can impact remote communities. How has that experience informed your work as the Minister of Health?
It's a great question because I have that lived experience of living in a very small community that is far away from other resources and seeing how people struggle with access to specialized forms of care. For example, getting out to see an ophthalmologist about your eyes, or a person who's diagnosed with cancer that needs to leave their community for treatment. It's really challenging. It costs money. It takes time away from your job. It takes time away from your family to be able to do that. And in fact, there are barriers that people face living in rural communities that make them less likely to even seek care in the first place. So I have worked really hard trying to understand better how the health system supports and maybe is challenged to support people who are living in rural communities. But also, having lived in Tofino for almost 30 years and having worked in Indigenous communities up and down the west coast of Vancouver Island, just the extraordinary challenges that First Nations people, Indigenous people face in particular, accessing a healthcare system that historically has not treated them well, has not been fair, where they've experienced racism, and trying to create more culturally safe institutions, hospitals, but also just different approaches to care. And the work that our government's been doing with the First Nations Health Authority to establish what's called a First Nations or Indigenous-led, First Nations-led primary care initiatives, where traditional medicine and Western medicine are come together and can service people better and in safer and more culturally appropriate ways, is it's really inspiring. And I actually think that we, the people who've grown up with Western medicine, have a lot to be learned from that.
Many British Columbians feel really overwhelmed when navigating the healthcare system. How is the province working to make health services more accessible, youth centered, and responsive to evolving community needs?
Well, that is a great question because people are living longer. They have more complex health conditions. There are all kinds of different services that people can access, but just knowing where to start can be really difficult. The Foundry is a program of youth-focused centers, really hubs where youth can come and access uh, primary care services, sexual health, mental health, family supports, all under one roof. So walking through a physical door and being able to access all of that in one place, but then also bringing that online through Foundry Online. And there's an app for that, so that youth can go there again. And we hear from youth that they feel it's approachable and accessible, and they can get their needs met in a very designed by youth centric model, which I think is something we need to see a lot more of. And so that's why we're working to expand that out across British Columbia. But even just for anybody of any age, like what to do, particularly if you don't currently have a family doctor or nurse practitioner that you are attached to and you don't have that primary care home. So 811 or HealthLink BC, online or telephone, the services that you can provide to speak to a navigator, then a nurse perhaps, and in some cases even speak to an emergency room physician who can help you through your health challenges and help direct you in the right place to go. We want people to get the right care in the right place at the right time, so we can do things like avoiding having to go to the emergency room if you don't need to.
Yeah, definitely. The emergency room wait is really long, and I feel like the Foundry really has revolutionized Canadian healthcare. So, you've led ministries focused on climate action and clean growth. How do you see the connection between environmental health and human health, and how might we shape um, this in the long term governmentally?
I think we don't spend enough time talking about the relationship between the environment around us and its health and our own human health. I think that traditionally in Western medicine, we think about an ailment or an illness that we have, and we don't center it in our relationship to the world around us or the people around us. So there is a lot from thinking about, clean air, clean drinking water. Those are basic necessities of life, but bringing in, and again, the growing integration of more First Nations or Indigenous led practices and around wellness and traditional healing, together with that Western medicine focus, where we're exploring and learning more about our human relationship with the world around us. We also know with climate change and floods, fires, for example, like these have real impacts on our mental health, but our physical health as well. So seeing smoke from forest fires and how that impacts people's health, the connections are, I think, being made better and are more stronger than they have been in the past, and we've got to continue moving in that direction.
Your leadership has often involved bringing together local governments, health authorities, and community organizations. In your view, what makes an effective advocate inside government someone who can collaborate across systems to improve people's well-being?
I think it's really important to bring all stakeholders or people from organizations or backgrounds that have different interests, but all share the goal of reaching a solution together. And those people have to sit around the table together. There's a um, something that we hear often in politics, I think, when you're talking to leaders of different levels, is, well, that's your responsibility. That we don't do that. That's what you guys are there for to do. And it is true that there are legal obligations that different levels of government have, but at the heart of it, we are all here to serve people and to help improve people's lives. And I think that's why it's so important to bring everybody to a table together to really talk through those different responsibilities and authorities that different levels of government have, for example. But also that saying of, like, nothing about us without us. So the decisions we make affect people, and the people that are being affected need to be at that table as well. So one of the real joys I have, I think, in being the Minister of Health in this ministry is the amount of work that we are able to do with people with lived and living experience. For example, when combating the toxic drug crisis, something that's incredibly devastating in families and in communities. But when we're designing care models or expanding that continuum of care to support people who are living with a substance use disorder, for example, it's just so vitally important to have people who are living that experience or who have lived that experience and can talk in a way that nobody else can about what it is like to move through that, and how we can design systems that support them the best.
You've previously chaired at the Tofino Housing Corporation, emphasizing housing stability as a part of a strong community. How can housing, affordability, and health play hand in hand? And what values guide your approach to addressing these interconnected challenges?
Well, housing, stable housing, is a core need for people. And it is hard to imagine how a person can stay healthy, can be able to be in a position where they're looking for work or working, maybe supporting a family, and without that core need met. The social determinants of health, access to clean water, clean air, good food, stable housing, enough income to be able to support the needs. Those can really drive a person's health, and they will drive population health. So we know that in rural communities, for example, where people have less access to these things, that we see that as a result in the health of the population. People have worse health outcomes and a harder time accessing the supports that they need. And so from my time living in Tofino, I've seen the impact it has on a person who does not feel secure in their housing, knowing that they may be evicted, that they may need to move. Raising a child in those circumstances is incredibly challenging. And with the work we've done in Tofino and building out affordable housing and providing opportunities for people to move somewhere where they know that it is safe, that it is stable, that they can afford it within their means or their income, and that it is secure, that they are not going to have to move or leave, has absolutely transformed people's lives. I've witnessed it firsthand, and for me, it's actually one of the most meaningful things that I've ever been involved in as a political leader.
So for this final question, could we just get you to look right into the camera?
Sure.
So BCYC is thankful to bridge the connection between youth and governance, but as an elected official, what is your message to the youth of this generation, whether in their future, their plans, or any advice you want them to think about?
That's such a good question. I think it's just so vitally important for youth to use their voice, to get into those spaces, to ask to be heard, and to assert themselves, to assert yourselves. You have experiences that we forget about as we grow older and that we lose sight of, and we need to be reminded of what that is. You are visionary, you are thinking about the future, you have a way, an outlook on the world that's different than anybody else. And I think it's so incredibly important to find a place where you feel comfortable, where you can assert that voice and use it.